welcome back to Face It with Dr. G. I'm Dr. G, and we took a little bit of a week hiatus and held ourselves accountable. Rachel held me accountable to be here because it's a priority, and I need to make it a priority. And with all the craziness happening in this world and at GFaceMD and beyond, I'm here and I'm so excited to talk to you guys today. And we're going to talk about a really cool case I had today, just thinking through and talking about my approach to this patient and the history. And she came to me after seeing another provider in my practice and really wanted threads. And everyone here does threads, but she was focused on having me address her concerns and talk about threads. So I went in to see her, and typically for all of you kind of on the business side, I don't really have appointments that are longer than 45 minutes. 45 minutes is my initial consultation, and then any other appointment is 30 minutes. And sometimes patients will use that to chat, and this time was just that. So she had a history of injectables, specifically Botox, years ago. She had 2 treatments of Kybella and was really wondering how she can fix her lower face that was sagging and full. She felt that Kybella didn't really work for her and wanted to be rejuvenated. So we went through the whole analysis, really focusing and educating her on the concepts that focusing on the mid-face first will help not only expose a jawline and lift the lower face gently, but will help us optimize the whole face as well as address the lower face later. And she understood and really loved that. We talked about her history, and this is where it got interesting. So she had a history of Bell's palsy, and she felt at this point she was pretty recovered, but still had some movements that were abnormal. And she felt she really smiled with a frown. And we mentioned neurotoxin for the lower face, but we got into that a little bit more. She uses her lower face in a downward motion to smile, which was interesting. And as she did smile, you could notice she didn't really know how to use those muscles. And she noticed that more after her Bell's palsy. So that could be a result of the Bell's palsy. And if you guys aren't aware of what that is, it's inflammation of the facial nerve. There are multiple different etiologies that can cause the symptoms, but you essentially get paralysis or weakness of certain muscles of the face, usually one side. And initially, you get complete 100% weakness of those muscles, and then as the nerve regenerates, the facial nerve regenerates, it takes time. And as it grows back and regenerates, you can have innervation of different muscles. So as that nerve regenerates and potentially innervates other muscles, you can get different spastic movements. So you can get smile and blinking at the same time, and this is called facial synkinesis. And it's important to understand this because when you treat patients that either have recently suffered with Bell's palsy and still have symptoms from it, you need to understand agonist muscles, antagonist muscles, how they function, because you can treat either the affected side or the weak side, or you can treat the normal side. And it really just depends on what the muscles are doing at that time. So are they weak and knocked out and they're not working because of Bell's palsy? And do you want to weaken the other side to make the patient appear more symmetric? Or is it the other way around? And the history is really, really important. So back to my patient, she had had Bell's palsy and now was recovered. She felt she was baseline, wasn't having any other symptoms, but still had asymmetry, and specifically of her lower face. And when she smiles and makes that frown, she thinks it's worse than it was before. So she also mentioned she knew she frowned a lot as a child and didn't like that, but now it's gotten a little bit worse. So addressing that with neurotoxin would be great. And in patients like this, I like to really emphasize the fact that if you are so ingrained, it's so ingrained in you, and those muscles have such memory that you're used to making that face day in and day out repetitively, you need to be aware as a patient that you will probably be uncomfortable with this treatment, meaning those muscles have not been used to being weakened, they have not been used to not being used, and you may feel trapped in your own animation, your own smile or frown for a little bit of time. And she was fine with that. She was like, I need to be forced not to do this face, not to make this face, and I'm okay with it. But I was very clear and reiterated this to her a bunch, that she may say, oh my gosh, I don't know what to do. I need to be able to make this face. I feel weird. So clarity and expectation management is key for these types of patients. So back to what we wanted to do when addressing her face. So she felt asymmetric. She felt that her muscles were just moving in a different way. So as I analyzed her, I looked at her mid-face. We agreed that a gentle lift and restructuring of her mid-face was optimal. And in her lower face, noticing that her left masseter was larger than her right, and she noted, I asked, do you chew on the left side? Yes, she chews on the left side, so that could be the cause of her hypertrophic masseter. So giving a little bit of injection of neurotoxin there to balance the face. And then underneath her chin in the submental region, she had a pocket of residual adipose tissue I could feel that I have seen in patients that have been treated with multiple rounds of Kybella. They just get this persistent fatty deposit that can't be, depleted or disintegrated or dissolved with Kybella. And I mentioned, after we optimize you with other modalities, lifting, neurotoxin, getting her perfectly symmetric so she feels beautiful and lifted, we can either decide we want to try one more round of Kybella, or I mentioned the gold standard for submental fatty deposits is liposuction. So we discussed that plan. She absolutely loved it. And then we also discussed how threads were probably not the right treatment for her. And why was that? Well, in my professional opinion, threads will reposition tissues, but they won't create symmetry from a structural standpoint, meaning her structure needed to be rebuilt deep down, more as a bony simulation of sorts, so creating that deep structure to give her both a contour, a gentle lift, and symmetry, whereas threads would reposition her tissues, but wouldn't give the result that I necessarily wanted, and I don't think she would like as well. Threads for her lower face and her jawline area would reposition those tissues, but again, if she still has an enormous volume of tissue in her jawline, I don't believe it's going to expose a beautiful contoured jawline that she actually had there that could be exposed. So explaining these thoughts to your patients is critical, and you can say, this is my professional opinion. Somebody else may give you a different one, but that's what I'm here for, and that's what I know you want to hear as a patient, and she agreed. The other thing is that I explained myomodulation to her. Myomodulation is when you inject a substance that creates support, and the muscle on top of that is myomodulated. Well, myo means muscle, modulate means modulate. So the muscle then works differently because of the support underneath it. And so that muscle will either relax because of support, which is usually the case, or contract, but it's usually the bony support allows relaxation of a muscle, and we love that. And by giving symmetry to a face with injectables, and in somebody who has had a history of Bell's palsy, it could create new memory for these muscles that are a little bit confused and help with her symmetry and help the way her muscles move. So we loved this plan. She was super excited. We're going to do this over the course of 2 weeks. Unfortunately, she's moving back to Washington, and I will be referring to my friends and colleagues that are out in Washington State. I think she's going to Seattle. But it's always bittersweet when you get patients like this and they're like, you know what, I just want to be perfect for when I go back home. And I said, I love that for you. I hate that for us, but love that for you, that we can make her feel her best in her own skin and want to take pictures of herself. She didn't want to take photos. She didn't like the way she looked. And that's when you are there as a provider to create harmony and beauty, but self-confidence in someone who just wants to feel like themselves again. So that was pretty cool. I loved this case. I hope you guys agreed. I'd love to hear your thoughts, because I think multiple providers could sit on a panel and discuss this case and have multiple different approaches and, have experience with this type of thing and do things a little bit differently. So I hope this helped. I will talk about some other really cool cases here in the future, and like, subscribe, share this. I will see you guys next time.